Hello, everybody. My name is Ian Alrawan, and I'm doing my honors senior thesis on the use of explainable AI for health. As part of that thesis, I have the privilege of interviewing world-class experts on the use of artificial intelligence for healthcare. In this episode, I interviewed Dr. Jun Deng. Dr. Deng is Yale University School of Medicine's professor of therapeutic radiology, and as part of that role, he's a board-certified medical physicist at Yale New Haven Hospital. Dr. Deng's work has a variety of aims, from big data for healthcare, precision medicine, and the use of artificial intelligence for clinical decision support systems. But in this particular episode, we focus on an important new concept called digital twins. Dr. Deng's work has a variety of funding sources from the National Science Foundation, the National Cancer Institute, and recently, Amazon. Also recently, Dr. Deng has launched an international initiative called the Digital Twins for Health Consortium, or DT4H for short. More on that at the end of the episode. And with that, I sincerely appreciate you listening and sharing this podcast. I hope you get something out of it, and I sincerely hope you enjoy listening to Dr. Deng. Thank you so much, Dr. Deng, for coming on, and could you tell me a little bit about your work at Yale?
Thank you for your invitation. And at Yale, besides my clinical work as a medical physicist, taking care of cancer patients, and my research is actually focused on recently focused on machine learning and AI for precision medicine and precision radiotherapy. So basically, we try to apply the AI technology and machine learning models to generate the best treatment outcome and strategy to take better care of our cancer patients.
Could you talk a little bit more about how digital twins have become more of a new focus for you, and how they've become a little bit more of the point of your research that you're exploring now?
Initially, in 2020, I participated in a NCI-sponsored workshop online. 30 of us participated in this 5-day intensive workshop. At the end of that, we form a team to write a project proposal. So the project we got funded for is about cancer patient digital twins. Specifically, it's about to generate the optimal treatment pathway for non-small cell lung cancers. And actually, this is related to my current work here, right? In our clinic, we deal with all kinds of cancer patients. Part of them are lung cancer patients, right? And then we use radiation treatment to cure our cancer, our patient cancer there. But on top of that, I'm thinking, how do I generate the best treatment outcome for cancer patient, right? Then we need the clinical decision support tool. Then we need AI support, right? So little by little, gradually, I realized that actually I need to gather all the data from the clinic and then generate the AI model. That AI model actually, in current version, we call digital twin of cancer patient, right? So digital twin of cancer patient can be applied to radiation therapy of cancer patients.
To give the audience a bit more of a general understanding of a digital twin, I have a definition here from a public lecture given by Dr. Karen Wilcox of the Odin Institute at the University of Texas. She defined a digital twin as a personalized, dynamically evolving model for a physical system. She applied it to things, she discussed things such as like specific patients and how they vary between each other, as well as dynamically evolving, so evolving with the patient. Do you agree with that definition, or do you think it should be kind of changed? What is your perspective?
In general, I agree with Dr. Wilcox's definition there. So in our version here, we talk about digital twin for cancer patients, right? Or digital twin for health. So either way, our version, my definition of digital twin not only covers that it's personalized, and it's also dynamically evolved. Those two aspects are covered by Dr. Wilcox's definition. And then on top of that, I think we should also add two more characteristics for that. One is a closed loop reinforcement learning. The importance of this is that we not only create a model, a digital twin for cancer patients, we also want the model learn by itself and improve over the time. based on the real-time feedback. So it's a closed loop feedback. And by doing that, benchmarking and the model gets better and better and more accurate. Another aspect I want to add here is bidirectional in time access. What I mean is that this digital twin modeling not only can be used to predict for the future for this particular person or system, but also can be used to review the previous status, right, for the system there. So yeah, in general, I agree with that. And I just add two more aspects here.
Also, what you might be hinting at is a view of your vision of the future of digital twins. Could you elaborate a bit more on how you think digital twins should evolve?
So our vision of digital twin, our definition is like, we think a digital twin for health or for cancer patient is a dynamic, interactive, in silicon representation of individuals or organs based on multi-scale modeling and fusion of multi-model data that can be used for monitoring health history, predicting physical and psychological phenotypes, developing tailored therapeutic strategies, improving lifestyle, and preventing future health problems in real time. So that's our vision for digital twin in health or digital twin in medical field. We actually focus on cutting edge research on digital twins for predictive health based on multi-scale modeling of multimodality data in real world and real time. And we believe that this effort is a huge endeavor and needs a lot of expertise.
Recently, you've begun to collaborate with my PI, Dr. Jun Deng, as well as other people on a project known as Digital Twins for Health. Could you elaborate more on that specific project?
We started this project last year and tried to respond to a Bridge to AI Grand Challenge project. We formed a team since then, and then we carry on with our great energy here. And it's really a synergistic effort here from all sides. This digital twin for health consortium right now consists of roughly 20 institutions, because it's always changing. So it consists of like 14 higher education institutions and like 3 non-for-profit organizations and 3 other for-profit organizations. Also, we have 3 professional collaborators, professional organization collaborators, and also 8 HBCUs, historically Black college and universities, right? We form a great team and network nationwide. There's several purposes of doing this. One is, of course, we want to do the cutting edge research and development around digital twin for health, right? Once you link all this digital twin modeling together from individual one, imagine that there are 7 billion people the worldwide. And what if we have 7 billion copy of that? And even a small percentage of that linked together, that's still very powerful. We talk about data pooling, and then benchmarking your AI model with the real world data. And so all these limitations we often talk about may become less challenging now, like the sparse data, right? The noise data and the data bias, right? All these things become challenging for the AI model developer right now. And then once you connect all this data, and that will be, the issue will become less severe.
Thank you so much for that answer, and also that optimism. I loved kind of hearing about your vision of like, what if every human being had their own digital twin and a great database for them. That was phenomenal to hear about. To get back to more like practical realities, what do you think are the main challenges that face the future of digital twins?
Yes, in my view, there are 3 major challenges that we're facing right now in implementing digital twin for real world application. Number 1 is data challenges. We all know that, and everybody's talking about that. So it's very hard to generate and also acquire high volume, high quality, and multi-scale data in a large, and those data, because are scattered and disconnected, at the multiple system around the world, across different domains. So sometimes they are sparse, sometimes they are noise, and then how to generate and acquire them together, and then those data are specific for one particular person, right, or patient here. It's very hard. It's very challenging. So that's number one challenging here, data challenging. Number two is I would say is modeling challenging, and the reason for that is we have two important pieces here. One is data, one is AI model, right? We know that to make this happen. AI model and modeling part is hard because we are dealing with multi-scale system and multi-scale phenomena happening. You can imagine for human body, it's very complex biological system, and actually a lot of process at the molecular and cellular level happening every second. We still don't know too much about that. And so if we don't know the phenomena happening right now, then of course the modeling part will be just a approximation of that process, right? We cannot get the real, the real world replica of that process. So modeling part is challenging, and we can try to get close to the reality, but we don't know what's going on there. And so I would say that to seamlessly integrate and then just data-driven and mechanical modeling is very challenging. So number two, modeling part is challenging. Number three is actually there's concern about ethical use of data and then community engagement. So of course you can talk about this thing together or separate. One is about ethical, how to use AI more ethically way and try to maintain the integrity of a person and then protect the data privacy there. That's the issue, everybody realize that. And there is another issue is what if you already generate some fantastic model and for that particular person, the digital twin of that. What if a person, the people or community members do not want to use that or do not know, have no idea what that can be capable of. And so they just ignore that. That's another issue, right? It's community engagement issue. In my view, it's about how to get more involved with people, whether the individual one or community, and how to get them involved and let them realize that the AI is actually ethical, is handled ethical way, and also AI is we can trust our AI and we can explain the AI in a more understandable way so that people get to know and when feel trust that the trust on this one and then try to use this AI model for their own benefits. So that's number three challenge here, ethical and community engagement challenge here.
Thank you for that phenomenal and thorough breakdown of all of the challenges facing the future of digital twins. And then back to a little bit more of an idealistic question, but if you had one sentence you could display to all types of people, venture capitalists, physicians, coffee baristas, what would that one sentence be for digital twins for health?
Digital twin is a virtual companion alongside of you through every health challenge.
Awesome. Thank you so much, Dr. Deng, for this interview. You gave phenomenal, thorough answers to every question, and I appreciated learning so much from you.
Thank you for giving me the time.